Okay, Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. For today's lesson, we will continue on the 6th content standard for chapter 10, which is health issues related to the human circulatory system. Okay, students, we have to maintain our healthy circulatory system. So what are the practices involved? These are examples how we can maintain our healthy circulatory system. Okay, the first one, balanced intake of food that is low in fat. Okay, perlu ambil makanan yang kandungan lemaknya sangat rendah. Okay, so example here, we can eat oat instead of white bread. Okay, kita boleh gantikan oat dalam sarapan pagi kita, gantikan mungkin sebelum ni makan roti yang berwarna putih tu, sebenarnya itu tak berapa nak elok lah untuk kesihatan. Okay, next, a regular exercise, for example jogging and then a brisk walk. Okay, maybe skipping. Okay, skipping dalam rumah zaman COVID ni. Okay, avoid smoking, please avoid smoking and not drinking alcoholic drinks. Okay. Now look at cardiovascular diseases. Penyakit berkaitan dengan jantung lah. Okay, cardio means that berkaitan jantung, cardiac muscle. Okay, vascular, blood vessel. First of all, atherosclerosis. Okay, atherosclerosis actually occur due to formation of plaque. Okay, formation and deposition of plaque inside the artery walls. Okay, in the artery wall. Okay, you can see here on the inner artery. Okay, dalam, bahagian dalam, bukan luar. Okay, so this plaque form from cholesterol and then lipid, dead muscle tissue, even the coagulated platelets. Okay, gumpalan platelets. So now the plaque will narrow the artery. Dia akan menyempitkan bahagian arteri. For sure, the blood flow will be restricted. Okay. Next, hypertension. Okay, atherosclerosis can cause hypertension actually. Okay, you can see causes by a restricted blood flow. Okay, jadi pengaliran darah sangat tidak smooth. Okay, restricted blood flow. So this will increase the blood pressure inside the artery. Then what will happen? The fine blood vessel, for example artery, okay, fine means that sangat halus, sangat tiny, okay, dia sangat delicate. So that high pressure will cause the artery to break. Dia akan pecah. So the person might suffer from stroke. So dia boleh dapat stroke. Okay, terutamanya melibatkan otak lah. If this condition happen in the brain. Okay, actually not even in the brain. Ini yang paling teruk lah. Kalau berlaku dekat bahagian neck belakang ni pun bahaya sebab efek juga pengaliran darah ke bahagian otak. Okay, and maybe around eyes. So boleh dapat minor stroke. Okay, so stroke also caused by blood clots. You have learned about thrombus and bolus. Okay, the blood clots and condition, thrombosis, embolism actually also can cause hypertension. Okay, the presence of blood clot will restrict the blood flow. That's why can cause hypertension. Okay, so blood pressure. You can check your blood pressure by using sphygmomanometer. Digital, memang banyak dijual. Okay, dekat Shopee jual, dekat pharmacy pun ada jual. Boleh check, mungkin seminggu sekali. Okay, so ini yang normal lah. 120/80 mm Mercury. Okay, ini unit bagi blood pressure. Okay. Ini contoh bagi elevated, okay, high blood pressure and hypertensive crisis. Ini dah critical, memang kena consult doktor. Okay. Next, arteriosclerosis. Okay, saya dah terang tentang atherosclerosis. Atherosclerosis actually the early stage of arteriosclerosis. Okay, so arteriosclerosis add on, tambah sekarang ni calcium. Okay, calcium deposited on the plaque. Okay, causes the artery become harder and lose its elasticity. Okay, elasticity of the artery, okay, keanjalan elastik awak tahu kan, anjal, so dia akan hilang sebab ada kalsium. Kalsium memang dia akan mengeras juga, okay, menyebabkan bahagian arteri itu dia akan harden. Okay, next, angina and myocardial infarction. Okay, ini lebih kepada sakit bahagian dada. Okay, angina just like macam minor heart attack. Okay, rasa sakit bahagian kiri. Okay, bahagian chest, severe chest pain. Why? Because when the lumen of coronary artery, the main artery that supply oxygenated blood and nutrients to the heart, become narrow. So the artery become narrow, maybe because of the plaque, the presence of the plaque, maybe the blood clot. Okay, so less oxygen will be transported, will be supplied to the muscle cell. Okay, so this will cause angina. Okay, the severe chest pain. And if the coronary artery is completely clogged, betul-betul tersumbat, the heart attack will occur. Serangan jantung akan berlaku. Nama saintifik ataupun istilah medical, myocardial infarction. Okay, so pada jantung, kalau memang tersumbat terus arteri ini, boleh dapat heart attack. Okay, next look at the treatments for heart failure patient. Okay, first one, medication melalui ubat-ubatan. Okay, yang kedua, second one, surgery and medical device. Okay, melalui pembedahan. Okay, peralatan untuk keluarkan mungkin plaque ataupun blood clot yang ada dalam coronary artery tadi. Okay, example here, coronary bypass surgery. Okay, mungkin awak pernah dengar bypass. Bypass tak semestinya untuk jantung, juga untuk perut. Okay, gastric bypass, kita dah belajar sebelum ni. So, coronary bypass surgery will be done if the artery severely blocked. Okay, teruk sangat tersumbat. Okay, so blood vessel, salur darah from leg, arm or chest bypass a blocked artery in your heart. Jadi, doktor akan ambil blood vessel mungkin daripada kaki, daripada tangan ataupun daripada bahagian dada untuk jadikan dia bypass dekat jantung. Kenapa? Okay, to allow blood to flow through your heart more freely. So, dia ganti arteri yang dah rosak tadi. Okay, so perlu bypass. Ini yang paling dah tak boleh selamat dah jantung tu, heart transplant. Okay, tapi high risk lah untuk buat pembedahan jantung dan tukar dengan jantung yang baru. Okay. So these are the risk factors that contribute to cardiovascular diseases. Kita tengok risiko-risiko. Okay. First, ini memang masalah rakyat Malaysia, unhealthy lifestyle choices. Banyak duduk, tidak banyak bergerak, kurang aktiviti. So, all this referring to sedentary lifestyle. Okay, kehidupan yang tak aktif. Okay, sedentary lifestyle. Tidak aktif. Okay. Not enough exercise or physical activity. Mungkin lepas makan tidur, lepas makan duduk tengok TV sahaja. Okay, tidak ada movement. Okay. Next, unhealthy diet. Dah lah suka duduk and then tak makan makanan berkhasiat, makan makanan banyak karbo, okay, rich in sugary foods, and then trans fats, okay, sodium, MSG including, okay, makan jajan semua tu, okay. Next, excessive drinking and smoking. Drinking for sure alcohol and smoking. Okay. Next, weight and waist size. Berat badan dan juga size waist kita lah. Okay. So, BMI of 30 or more are termed as obese. So, better check. Better calculate your BMI. Zaman COVID ni tak banyak bergerak. Pastikan awak makan pun kurang, jangan berlebihan. Okay. So, for a woman with a waist beyond 31.5 inch or 80 cm, boleh ukur gunakan tali tape tu. Okay, mungkin ada di rumah awak. Okay, ibu awak guna untuk ukur baju awak dan sebagainya. Tolong cek. Okay, untuk kaum perempuan. And then for a man with a waist beyond 39 inch or 94 cm are typically at a higher risk. High risk of getting cardiovascular diseases. Sangat bahaya. So, better check. Okay. Okay, students. Next, high cholesterol. So, high cholesterol in your blood actually will prevent the blood from reaching your heart. So, less oxygen will be transported to your heart muscle tissue. And of course, to other parts of your body. Okay. We can bring down the cholesterol level by regular exercise, okay, jogging. Mungkin tak nak jogging. Sekarang zaman COVID ada yang takut nak keluar, boleh gunakan tangga di rumah. Tak ada tangga juga, beli tali skipping. Tak nak buat juga, buatlah macam mana pun, berkebun ataupun maybe lompat bintang, maybe buka YouTube, menari zumba dalam rumah, tak ada orang tengok. Memang sangat penting. Okay. Next, follow a diet that is low in trans fat. You better check ingredients. Okay. Saturated fats and cholesterol. And taking doctor prescribed cholesterol medicines. Okay. Sesetengah orang, bila dia dah check cholesterol level, actually doktor akan prescribe ubat yang sesuai untuk turunkan kandungan kolesterol. Okay, kalau perlu memang perlu ambil lah. Okay, next, depression and heart disease. Stress actually can contribute to cardiovascular disease. Okay, and heart disease for sure. So, excess stress. Sekarang ni banyak fikir, so maybe lead to depression. Okay, sangat sedih, consistent sad feeling, or both actually will increase your blood pressure. Tekanan darah akan meningkat. Okay, sebab tu kalau stres sangat dia rasa sakit kepala dan sebagainya. So, with timely intervention and professional help, so please, if you feel depressed, okay, cari kawan. Ataupun mungkin ibu bapa. Tak nak cerita dengan ibu bapa, better carilah orang yang sesuai untuk awak ceritakan apa yang awak rasa. Okay? Kalau rasa cikgu, cikgu lah. Tapi jangan cari orang yang awak tak kenal langsung. Okay? Depression actually can be controlled and completely cured, and ways of cardiovascular disease also can be prevented. Okay? Kita boleh kurangkan risiko. Okay. Next one, diabetes and heart disease. Okay. So, people with diabetes are twice as likely to develop a heart disease. Orang yang ada penyakit kencing manis memang lebih senang dapat penyakit berkaitan jantung. Kenapa? Okay. The high sugar level in the blood, okay, will increase the amount of plaque formed inside the artery. So, more coagulated platelets, okay, fats, and so on. Apa yang saya terangkan tadi, dia akan berkumpul, okay. So this will stop or hinders or restrict the blood flow to the heart. So can lead to heart attack or myocardial infarction. Okay. Okay, next, smoking. How does smoking lead to cardiovascular disease? Smokers have double the risk of having heart attack because of tar, nicotine. Okay, all this actually will accumulate in the lungs, and then less gases exchange, so less oxygen transported to the body cell. Okay. Next, cigarette smoke also contain chemicals that will damage artery. Okay. So your heart will work twice. Lebih susah lah nak bekerja, nak pump darah pun, darah dia sangat pekat sebenarnya. Okay. Family history. Ini pun salah satu risk. Kalau keturunan ada penyakit berkaitan dengan hypertension, diabetes, so increase juga risk untuk dapat. Okay. So example here, if parents have a heart disease, then the children are likely to develop the same, especially if a parent develop it during an early age. So kalau umur 20 lebih, 30 lebih dah dapat penyakit ni, walaupun jaga pemakanan, so high chance untuk awak pun dapat juga. So better check. And please control your consumption of cholesterol rich food. Okay, fast food, example KFC, Pizza Hut, and so on. Okay, so individuals with a strong family history of a cardiovascular disease likely to develop one or more risk factor. Jadi kat sini, kalau memang sejarah salah sila keturunan awak, okay, ada penyakit diabetes, okay, ada penyakit hypertension, so memang lebih mudah untuk dapat. Okay, and please involve yourself into a disciplined exercise regime. Seminggu 3 kali. Okay, dan please jaga pemakanan. Eating only balanced diet. Sekali-sekala, jangan jadikan every day is a cheat day. Tak boleh lah. Okay. So that's all. Thank you.